Hello future RNs. Okay, so for this video, ang pag-uusapan natin is all about the safety issues and nursing interventions for patients taking psychotropic medications or yung mga psychopharmacology or yung mismong psychopharma natin in general. So remember nurses that in every disorder in your psych, of course, meron po silang mga corresponding medications to treat and to manage kung ano mang disease yan under your psych, okay? Di ba sabi natin before, we have your antipsychotics, okay? We have your antidepressants, we have your mood stabilizers, and of course, we also have here your anxiolytics. So, sabi natin before, it depends kung ano yung kailangan nating i-manage sa disorder. Like for example, we have to manage yung mismong problem ng patient natin when it comes to their cognition, when it comes to their thought processes. Okay, that is usually presented or manifested by patients na merong schizophrenia. And then however, for patients naman who have mood and affective disorders like your mania, okay, and your depression, you have your antidepressants, and of course, meron tayong mga mood stabilizers. And of course, pag sa mga patient naman na merong anxiety, we have medications like your anxiolytics or anti-anxiety agents. Okay, so mag-start muna tayo with your antipsychotics. So here are the issues. Okay, also here are the safety issues regarding with the use of your psychotropic drugs, particularly your antipsychotics. So number one, ang issue natin for patients who are taking your antipsychotics is what? We have your EPS, okay? Yung patient natin na nagtitake ng antipsychotic medication, okay, pwede silang magkaroon ng EPS. Okay, so si EPS natin or your extrapyramidal side effects or your syndrome, di ba nandito napapasok yung mga tinatawag natin before like your pseudoparkinsonism, ano pa, nandito yung tinatawag natin na acute dystonia, and same true with your what do you call this one, acute dystonia, and then your akathisia. So those are the examples of your extrapyramidal side effects or syndromes natin. So ngayon dito, of course, tawag dito sa mga gamot na ganito, like your antipsychotics, ang number one na kailangan natin i-assess, okay, or kailangan natin gawin is, you have to instruct your client, okay, if they experience, okay, any signs of your muscle stiffness, because your muscle stiffness or spasms, they are usually related or somewhat related with your, it's either in your pseudoparkinsonism or in your acute dystonia. So pag yun ang nangyari, pag nagkaroon sila ng any signs of your muscle stiffness or spasm, what are you going to do? Sabi natin during our discussion with your psychopharma, you have to hold the medication. Okay, we have to withhold the medication, and then you're going to notify the physician. Okay, so yan pang gagawin natin if your patient experiences any signs of muscle stiffness or spasms that are usually related with your EPS natin. So what else? For example, si patient nagmanifest siya ng mga symptoms ng ating pseudoparkinsonism. If you could still remember yung mga symptoms, signs and symptoms of your pseudoparkinsonism, like your pill rolling, mga ganyan, what are you going to do? That's the time that you have to give, okay, yung antidote natin or yung mga dopaminergic agents or yung mga anti-Parkinsonian agents natin. Okay, like for example, you have your levodopa. Okay, you have to give that kasi pag si patient nagmanifest any of these signs of your tawag dito, acute dystonia, same for with your pseudoparkinsonism, that's the time that we could give your anti-Parkinsonian agents natin. Kasi yan po yung mismong antidote natin for this one. Anti-Parkinsonian or yung mga dopaminergics natin. Okay, so what else? Of course, pag si patient nagmanifest siya, for example, ng mga abnormal na involuntary movements like that are usually manifested sa mga merong pseudoparkinsonism, kailangan nating ma-assess or kailangan nating ma-assess lahat ng mga signs na yon. Okay? So, next naman here, we have your antipsychotics can usually lead or can usually result to hyperglycemia. Okay? Pwedeng tumaas yung kanilang blood sugar. What else? Pwede silang mag-gain ng weight. And of course, pwede silang magkaroon ng DM. So, what are you going to do with this one? What will be your intervention for this patient? Remember, since ang problem natin dito is the regulation of your blood sugar, of course, number one, you have to assess for what? You have to assess for history of, okay, assess for any history of DM. Okay, so for patient na nagtitake ng ating antipsychotics, you have to assess, you have to verify first if they do have history of your DM. Kasi sabi natin, it can cause hyperglycemia. Okay? What else? Of course, since nagkakos siya ng hyperglycemia, what will be our intervention here? Of course, we have to monitor from time to time. You have to evaluate the blood sugar of your client who are taking your antipsychotics. And then lastly, dito na po papasok po yung mismong importance ng ating health teachings for those who are taking your antipsychotics. Since sabi natin kanina, there's a problem with the regulation of your blood sugar, what are you going to do? You have to instruct your client the importance of what? Importance of your diet and your exercise para ma-regulate po natin na mabuti yung kanilang blood sugar. Okay? And then lastly, of course, when it comes to monitoring any symptoms, any signs of your hyperglycemia. Okay, ano ba yung mga signs ng hyperglycemia natin? Diyan papasok yung tatlong P natin. Ano ulit yung tatlong P natin for this one? Number 1, we have your polydipsia. Okay, polydipsia, meron silang insatiable na thirst. What else? They also have your polyphagia. Okay, palagi silang nagugutom. And then lastly, pwede silang magkaroon ng polyuria. Okay, or masyado silang, tawag dito, palagi silang ihi ng ihi or madami masyado yung kanilang urine output. Okay, so that is your interventions for this safety issues regarding with your antipsychotic medication. Next naman tayo here, we have your hypotension. Okay, remember, pag si patient natin na nagtitake ng ganitong klaseng gamot, it can lead to possible orthostatic hypotension. Or it's not only your orthostatic kasi magkaiba yun, it can lead to hypotension, pwedeng bumaba yung kanilang blood pressure. So what are you going to do? You have to educate the client, okay, about the risk for experiencing hypotension or pagbaba ng kanilang blood pressure if they are taking this kind of medication. Okay, so dyan papasok yung mismong pag-monitor natin from time to time, closely monitoring your blood pressure of your client. Okay? And then next naman here, we have your orthostatic hypotension. So dito sa orthostatic hypotension naman, nurses, ano bang ibig sabihin ng orthostatic? This is just your postural changes in your blood pressure. Okay? For example, pag nagkaroon tayo ng changes in our posture, pwedeng nagkakaroon ng erratic changes or drastic changes. Okay? Or pagbagsak ng ating blood pressure. So what are we going to do with this one? Of course, you have to instruct your client to rise slowly. Okay? You have to instruct your client to rise slowly from sitting to standing para hindi magkaroon ng drastic change dun sa kanyang blood pressure. Okay? So what else? Of course, you have to monitor yung kanyang BP. Kailangan nating i-monitor yung BP ng client natin. Okay? For example, nakahiga mo na yung client mo, you have to check the BP and then you are going to allow your client to stand. Okay? Pag tumayo siya, dapat ma-assess natin if there are any changes dun sa kanilang blood pressure pag nagbago tayo ng kanilang position. Okay? So that is your orthostatic hypotension. Next naman here is that yung mismong antipsychotics natin kasi it can cause possible dito sa may mismong lower seizure threshold. So dito pa lang, of course, once before na mag-take yung client natin, of course, you're going to kailangan natin i-assess yan rigorously. Okay, kailangan nating i-assess yan para sa ganun, makita natin if there are possible contraindications for them if they are going to take this kind of medication. Like for example, since bumababa yung mismong seizure threshold ng classic client natin, particularly yan sa mga gamot, like for example, we have your clozapine. Okay, yung clozapine na yan, okay, it can cause seizure. Okay, for example, one of the effects or adverse effect of your clozapine, pwedeng magkaroon ng seizure yung client natin. So what are you going to do is that you have to assess, okay, yung client natin, if meron ba siyang history of seizure disorder. Okay, you have to thoroughly assess if yung client natin, meron ba siyang, meron ba siyang history of your seizure disorder. So what else? Of course, dito na papasok yung monitoring natin kay client. Okay, you have to monitor yung client natin for any evidence, okay, of any seizure activity. And pag nagkaroon siya ng any seizure activity, that's the time that you have to notify your physician or yung mismong nurse practitioner ng client natin. Okay, so that's with your another issue again. Okay, so what else? So nakalagay din dito, nakalagay din po dito is that you have to check, okay, yung client natin kasi pwede sila mag-experience ng prolonged QT interval. Okay, particularly ano ba yung mga gamot or antipsychotics natin that causes QT interval or prolonged QT interval natin. Of course, dyan papasok yung mga very common. You have your Haldol or your haloperidol. Okay, it can cause your prolongation of your QT interval. So, what are we going to do with this one? Number 1, okay, you have to assess yung client natin Okay, if meron ba siyang history of what? Meron ba siyang history of arrhythmias or any arrhythmic disorder? Okay, check natin yan kung meron ba siyang any history of your arrhythmias. Okay, nagkaroon ba siya ng recent na myocardial infarction? Ano pa? Meron ba siyang heart failure? And of course, kailangan kasi natin yan. Pag na-assess natin na meron siya any of this history, you have to assess your what? Or you have to report that to your prescribing physician. Okay, you have to notify or report agad yan sa mismong physician or sa mismong nurse practitioner ng client natin. Because these events like your any cardiovascular problems, these are, these are contraindications kay client na merong magte-take ng ganitong klaseng gamot. Okay? So, what else? Of course, you have to assess for any other medications as well. Okay? That could actually prolong yung mismong QT interval ng patient natin. Marami kasi tayo niyan. Like, for example, marami tayong mga gamot. Okay? That could actually cause prolongation of your QT interval. Like, yung mga antibiotics natin, for example, yung mga macrolides natin. Okay? Like your like your erythromycin, okay? Erythro and your clarithromycin. So, these are the most common prescribed kasi na gamot, okay? That could cause your prolonged QT interval natin. Erythromycin and clarithromycin. Okay? So, next naman, aside from that one, of course, since sabi natin, no, since pwedeng mag-cause to ng any disruption, okay, dun sa mismong cardiovascular ng patient natin, status ng patient natin, that's the time that you have to instruct your client, okay, that if they experience any of these signs, like for example, pwede siya magkaroon ng rapid heartbeat or magkaroon siya ng palpitation, kailangan niyang i-report yan. Okay, what else? Kailangan niyang i-report if they do suffer from dizziness. And then, of course, last will be your fainting. Okay? And to check, okay, as part of your baseline data para ma-assess natin if si patient nagkaroon na ba siya ng prolonged QT interval while taking this kind of medication, of course, you have to check for what? You have to check for the baseline ECG. Okay, para maging yan po yung mismong interpretation ng ECG, that will be our that will be our baseline data prior beginning with this treatment bago magbigay ng ganitong klaseng gamot. Okay, prior beginning the treatment. Okay? So, next naman tayo here, we have your, possible anticholinergic effects. Okay? So, remember, yung mga antipsychotics natin, pwede kasi silang mag-cause or pwede silang mag-cause ng, ng any, anticholinergic effect kay client natin. So, that's the time that you have to instruct your client natin about yung mga additive effects, okay, na may ibang klase ng mga anticholinergic medications in combination with your antipsychotics. And aside from that one, if any of this medication, okay, taken together with your antipsychotic, kailangan nating malaman yan. Kailangan nating alamin yon so that you can report it to your attending physician. And aside from that one, you have to check, okay, report any other medication. Okay, like for example, yung mga gamot natin that are considered OTC, and even with your excuse me po for a while, like yung mga over-the-counter medications natin, and even yung mga herbal medicines natin or herbal meds natin, okay, usually kasi itong mga to, they could actually, meron kasi silang anticholinergic effect. So if you're going to combine it with your antipsychotics, pwedeng, mas lumala yung kanyang anticholinergic effect ng mismong gamot. So, you have to assess for that one. And aside from that one, ano ba yung mga effects natin? Okay, or mga anticholinergic effects natin, di ba? Dry yan. Okay? Possible yung client natin, pwede siya maka-experience ng, number one, pwede siya maka-experience ng dry mouth. Okay, so pag nagka-dry mouth yung client natin, anong number one na instruction natin sa kanila or management natin sa kanila? We are going to recommend to suck on what? Suck on hard candies. Okay? They have to suck on hard candies or chew on hard candies. And of course, sip of water lang po. Hindi ka pwedeng magbigay ng sobrang daming tubig para sa kanila. Because, sabi natin before that, yung mismong anticholinergic, what will happen with their urination? Pwede sila magkaroon ng urinary retention, di ba? Pwede sila magkaroon ng urinary retention. That's why you have to instruct, since anticholinergic effect yan, you have to instruct your client, okay, to report and assess them if for any evidence of your urinary retention. Kaya hindi ka din pwedeng magbigay ng sobrang daming tubig sa kanila because yung mga anticholinergic effect ng gamot na to, it can cause urinary retention. Okay, so what else? Pwede siyang mag-cause ng possible tachycardia. Okay, as part of your anticholinergic. So you have to assess for any of this one. Tachycardia and hypertension. Kasi itong mga indications na to, they could be a sign, okay, that they are having anticholinergic toxicity because of this antipsychotics. Okay? So, next naman tayo here, we have your sedation. Okay? Usually, nakakakos kasi talaga ng sedation yung mga antipsychotic na drugs natin. So, you have to educate yung client natin, okay, with this side effect ng gamot. Okay? And, anong number 1 instruction natin if ang isang gamot, it causes sedation? Number 1, you have to instruct your client not to drive, okay? Not to drive or operate. Di ba? Palagi nating paulit-ulit ang sinasabi ito. Not to operate any dangerous machinery if experiencing sedation. Dangerous machineries. Okay? So, next naman issue here is your photosensitivity. So, dito sa photosensitivity natin, okay, remember, ang number 1 instruction natin kay client is that we have to instruct them, okay, to use your sunblock. Okay, kailangan natin i-instruct yung client natin na gumamit ng sunblock and even with your sunglasses to protect, okay, yung kanilang skin. Because, sabi natin before that, if a patient is taking your antipsychotics, pwede siyang mag-cause ng what? Severe sunburn while on this medication. Okay, so you have to instruct your client to use your sunblock. What else? To use your sunglasses as well. And then lastly, of course, kailangan niyang mag-wear ng mga protective clothing. Kapag hindi nila maiwasang ma-expose sa sun. Okay? So, what else? How about with your agranulocytosis? Diba? Number 1, very common ang agranulocytosis natin, particularly sa mga typical antipsychotics natin. Like, for example, dun sa mismong clozapine natin. Diba? Paulit-ulit yan. Yung mismong clozapine kasi, ang kanyang classification, typical antipsychotic siya. So, if your patient is taking your clozapine, of course, you have to instruct your client natin, okay, that you have to regularly monitor the what? Okay, regularly monitor your WBC. Okay, you have to monitor yung mismong WBC ng client natin because, remember, ang ating problem dito, particularly yung mismong neutrophil count ng pasyente natin, very essential yan na check. Okay, so what are the symptoms of your agranulocytosis? Number 1. Okay, number 1 na alam natin, nasabi natin yan sa discussion natin before, we have your sore throat. Okay, aside from your sore throat, we also have your fever. So, kailangan nating i-assess if the patient na nagtitake ng typical antipsychotics, particularly your clozapine, okay, tignan mo na mabuti, i-assess mo na mabuti if they are suffering from simpleng simpleng fever, simpleng sore throat, because this could be an indication that your patient is suffering from your, from your agranulocytosis. Okay? So, what else? You also have here your NMS. Okay, or your neuroleptic malignant syndrome. Ano ba yung mga indications sa possible si patient natin? Meron siya, nakaka-experience na siya ng NMS. Okay, number 1 dyan, if your patient is suffering from possible muscle rigidity. Okay, nagkakaroon siya ng muscle rigidity. Okay, what else? Nagkakaroon siya ng sobrang taas na or high fever. And then lastly, pwede siyang na merong erratic na blood pressure or pwedeng there's a drastic change dun sa kanyang blood pressure. So, isa yan sa mga manifestations that your patient is experiencing your neuroleptic malignant syndrome. Okay, so if any of this manifestation, okay, mag-occur kay client, you have to instruct them to report it immediately. Okay, if mag-suffer man sila ng fever, magkaroon sila ng muscle rigidity, sabi natin, di ba, what else? Magkaroon sila ng diaphoresis and even with your tachycardia, you have to instruct them to report it immediately. Okay, report immediately. Okay? That's why dito papasok yung mismong assessment natin from time to time ng kanilang mga vital signs. Okay, particularly your temperature, no? And then aside from that one, okay, you also have to assess if your patient is suffering from what? Pwedeng mag-deteriorate din kasi, yung kanilang mental status. Okay? Pwedeng mag-deteriorate yung kanilang mental status. And if any signs, okay, that their mental status is deteriorating, you have to what? Anong gagawin natin dito? We have to hold again the medication. You have to withhold the medication, and aside from that one, you have to notify yung mismong prescribing physician or yung mismong nurse practitioner immediately. Okay, as well as of course, monitoring your vital signs and your intake and output ng pasyente natin.